of the RCP Iraq network. I'm going to quickly review what we said last night about this program that was designed to enhance the skills and knowledge of medical educators in 4 Iraqi medical colleges, Wasat, Al-Amid, Al-Kafil, and Sulaimani. The aim is to establish a TOT group of medical education in the 4 medical colleges. Target audience is faculty members from 4 medical colleges, seniors and juniors, as well as medical students interested in medical education. This course is presented on Moodle platform with all its associated data and pre and post test evaluation, as well as all the assignments. So make sure you have your account activated and keep your eye on the notifications and complete all the required assignments to be able to obtain your certificate at the end of the course. Module 2 is about learning objectives, and by the end of this module, all the attendees shall be able to recognize and apply the key principles of undergraduate to educational practices, and to construct clear and measurable learning objectives, as well as communicate effectively the expected practical skills outcomes. And last but not least, to apply these objectives to specific tasks or course modules. This course is the second, this module is the second out of 6 modules designed to be presented throughout this course. The requirements to successfully complete the capacity building course is to attend a minimum 5 of the 6 modules, participate in the pre and post test evaluation, participates in discussion forum for each module, and complete the assignments for each module. Today's presenters would be Professor Dr. Batul Ali Ghalib. She is a family and community medicine specialist, Department of Community Medicine, College of Medicine, University of Baghdad, as well as Professor Dr. Nazar Haddad, a consultant in chemical pathology. He has a diploma in health profession education. He is a member of the senior steering committee in the medical education subgroup of RCP London Iraq Network. He is a part of the examination committee of Arab and Iraqi Board of Clinical Pathology. The timeline for day 2 will be writing learning objectives of smaller group teaching session presented by Dr. Batul Ali Ghalib, and then writing learning objectives of a practical presented by Dr. Nazar Haddad. And then we'll have all your questions answered by the end of the session, inshallah. The ground rules for the meeting: don't forget to keep your mobile phones silent, to keep your microphones turned off unless you are asked to turn it on. Type all the questions or inquiries you have in the chat box, and I would also like to remind you to register in the Google form that will be published by my colleague Sarah soon in the chat box to be able to obtain your certificate at the end of the course, and raise hand during discussion to take your part and participate. Now let's enjoy the learning experience. Dr. Batul, the stage is yours.
Thank you, Mariam. Assalamu alaikum jami'an. I don't know, I will share my, is it okay?
Yes, it's okay.
Yes, it is.
Thank you. Okay. Yesterday, Dr. Hilal, as you may remember, because yesterday is not so far, defined goals, aims, objectives, competencies, and outcomes, and he tried to clarify the small differences between each of these terms. Then he went through the steps to design effective learning objective, and after that, Dr. Basim lists the advantages of learning objectives and their role in planning and evaluating educational activities. And then he went through the differences between instructional objectives and learning outcome. And then he explained the 3 domains of learning: the cognitive, which is the memorizing, the reasoning, or the thought of thinkings, and the affective, which is the emotions or feeling, and the psychomotor, which include the action and doing. Then he explained something about Bloom's taxonomy, and from the knowledge at the base to the creation at the apex. He explained clearly the cognitive levels, which include knowledge, comprehension, application, analysis, synthesis, and evaluation. Then the psychomotor, perception, set, guided response, mechanism, complex overt response, adaptation, origination. And then the last, the affective domain for receiving, responding, valuing, organizing, and characterization. Then he went through how to write the learning objective, and he explained that the learning objective should be SMART, which is for specific, measurable, achievable, relevant, and time-bound. Then he went through the steps that we have to start with the STEM, determine the learning outcome, consult then the Bloom's taxonomy to select the verb and put them together into statements.
عفوا استاذه بتول انت بدك تحركين سلايدات لو لا لان احنا بس السلايد ده
This is only revision for yesterday.
اوكي شكرا.
Today we are going to talk about the learning objectives in a small group. How to write a learning objective for a small group teaching session. Actually, the details of the setting of the small group will be explained in the coming module, inshallah. And now we are only concerning with how to write the objective of this learning activity. Okay. يتحرك مو تمام؟
Yes.
The aim of this, we have to recall the definition and importance of learning objectives that you have already had it yesterday, and identify the component of learning objective for a small group session and differentiate between good and poor learning objective. I am going to ask you one question first. Can anybody define learning objective? This is a recall for the previous day. You can put your voice better than writing, I think. Just if anybody, one or two, can define learning objective.
You can participate either by opening your mic and directly, or by putting your text on the chat box. No one? It seems to be yesterday no one understand what we have said.
No, I don't think that, Hilal, but I think it was confusing for them. حقيقة, we all were confused when we have all these terms together. But with time, these things will be very easy to be understood and to be easy after practicing writing the objectives. You will find it that it is very easy. I'm sure you are confused from yesterday, but with time, don't worry. With time, you will get used of these terms.
There are a few statements on the chat box, Batul.
Okay.
Dr. Muhammad is saying specific detailed statement that learner should be done. Dr. Muhammad Nasir, learning objective are specific behaviors to be gained from a specific session.
يعني they are nearly they are the same, but actually يعني the most simplest definition is that learning objective are clear, concise, and specific statements of observable students' behaviors ليش that can be evaluated at the end and contributes to reaching the goals of the whole learning session. فإذا هي clear statements, concise, for a changing behavior. Okay, then what do I need? Why do I need to write learning object? Is it that important? احنا قبل كنا نكتب lectures without writing objectives.
No, Dr. Diar is saying to instruct the teacher and the student.
Excellent.
Who else?
السلام عليكم جميعا.
عليكم السلام ورحمة الله.
دكتورة، بالنسبة للأوبجيكتيف أنا حتى نهرب مثل ما حضرتك قلتي إنه إحنا we have to achieve by certain period of time certain things. لذلك إحنا مهم إحنا نحطها حتى نتأكد إنه إحنا راح حققنا المطلوب من هذا teaching session whether إذا كان lecture أو أي شيء آخر. فهو هذا السبب اللي أنا أكتبها، ومثل ما حضرتك حطيتي بالمقدمة
whom you are as a teacher or as a student.
لا هو طبعا the best thing احنا عندنا student centered هو learning definitely. بس اني كفاسيليتيتر راح اعرف عندي curriculum معينه احط objective حتى انا I want to achieve هذا الشيء اللي يمشي مع الكريكولم اللي عندي.
You want to direct your students or your learner. تمام؟
بالضبط.
You want to direct them. فالأول شيء إنه it is to what you value and expect them to be able to. نوجههم, we direct the students or the trainee to what we want them to do. The second thing, we specify the desired outcome, not only what we want them to value and to expect them to do, but to specify the desired outcome, a learning outcome اللي احنا بالبداية we have to explain and we put it there. And the most important thing, it will help in assessing the performance of students. And if you remember that, I think Hilal said something about education, you remember from module 1, that the educational strategies, you're not only lecturing or giving, it is a very big operation, very big organization, and one of the important parts of it is assessment. To assess or to make assessment important, you have to establish objective, because from the objective, you know what you are going to assess. The type of objective will give you a hint about the way of evaluating and assessing your students. Are you going to assess by written question, MCQ, essay, or, for example, by OSCE stations, by long case, short case, whatever, skills, mastery, all of these are desired after you put your objective. So if you are clear and concise in putting your objective, you can easily find the way of assessing your learners and your students. Learning, actually, and I was happy to hear it yesterday from one of the colleagues. He said changing behavior, and actually it is very, very nice definition. Actually, by learning, the student will be changed from not knowing to knowing, or unable to do to doing. So students acquiring new skills and knowledge, this is the learning. And learning objective describe a direction for a student acquiring new skills and knowledge. It is a roadmap. That's why we are interested in writing the proper proper way of writing objectives. Is there a benefit for these objectives? Definitely. We have benefits not only for students, benefit for students and the benefits for the teachers and the program manager. For the students, it clearly identify what students will be able to do after attending the session or after finishing the course. Help them to understand how the knowledge skill will be applied in a specific context in the future, how you are going to apply these skills or this knowledge in future professional life, and so on. For the teachers, it will guide program development and selection of instructional strategies and material. Will help you for selecting the way of performing your session or delivering your materials. It also measures the effectiveness of the program. It will identify the gaps, weak points, and cons of the session or the teaching activity, and improve the learning for future session. And definitely, as we said before, it will guide assessment for the students. الدومينز فور اللي قال عليها دكتور بسيم حكى عليها عن دكتور هلال. We have the cognitive learning objective ومثل ما قلنا this is the knowledge field اللي هي ممكن تكون knowledge, comprehension, application, analysis, and etc. And the effective learning domain objectives اللي هي تشمل feeling field for the student performance, for receiving, responding, valuing, organizing, and so on. And then the final, which is the psychomotor learning objective, which will indicate the doing field, and it will involve using the coordination of skeletal muscles, vision, hearing, speech, sense to imitation, manipulation, precision, اللي هو هذا this is the final doing or performance. The sequences of writing the objectives actually it will start by يعني مرات بتشكل عندي حقيقة إنه هي sequences مالتها a lot of people say very different effect of these sequences, but Robert developed a hierarchy of learning starting from factual learning, which is the itemizing information, collecting information اللي هو level of the collecting knowledge. To the second part is conceptual learning, which include classifying information. You have collect this information, you have to organize and classify this information, and then a principal learning, which will include to relate two or more concepts together, and the final problem solving, which is the final one to apply principles and predict outcomes. Definitely, we cannot start from the upper. We don't start with the problem solving. To reach the problem solving, we have to pass through the factual, conceptual principles, and then reaching these things. It is not only you jump to the higher principle, no, you need to pass through all of them so that if you remember from the previous module that you have to build on already available information or knowledge or whatever. So student uses lower level learning to build the skills for the higher level learning. Dr. Basim yesterday also goes through these. When you are going to write your objective for a certain session, many questions or some questions you have to ask. For example, what are the essential things that learner should know after the session? I got something from my father, God bless his soul. He was a teacher in the medical college in anatomy department. He said, when I want to examine the student, I want to know how much he knows, not how much he doesn't know. And from this, you have to identify in your objectives what you need this student or this trainee to know. What are the essential things that learner should be able to do? But first of all, what he should know, what he should be able to do, and what knowledge or skill will be new to the learner in this course, meaning you have a previous idea about what he has previously learned from the previous years. And then how do the knowledge or skills to be learned contribute to the learner's practice and professional life? How can he use what he learned and what skills he is performing correctly and effectively in his future life as a doctor, day one doctor, or even in the lifelong learning activity. And then how this knowledge or skill will contribute to the patient experience and lead to improved patient outcomes. Even it is a cycle from the early learning to be a competent doctor or a competent physician that he can help his patient to be improved. to write a learning objective in a small group, writing learning objective in all sessions is the same. But each session has its priority, its sensitive thing. In a small group, it is not like large group. Large group, mainly knowledge. You can put other things in it, but it is mainly knowledge. In a small group, you want them to be more than only level of knowledge. You have to focus on student performance, not teacher performance. You have to focus on your student performance, not on your own performance. You have to include usually one learning outcome per objective. Don't make it difficult. Don't make it complex. Very simple. Simplicity is a beauty and is understandable. Usually, of course, the frame of writing objective, usually we start with a statement that by the end of this session, by the end of this course, the student will be كذا, and then it will be followed by a bulleted statement, starting with each statement will start with a verb, followed by the content as Dr. Basim precisely gave. بالsmall group, in the small groups, we don't, as I said, we don't focus on mainly knowledge. We focus on practical skills. Practical skills, objectives should emphasize hands-on practice and application of knowledge. You already have the knowledge, or you may recall the knowledge that you already have it, but it will emphasize on your skills. For example, student will be able to perform a basic cardiac examination. Of course, they have information about the cardiovascular system and how to examine the cardiovascular system and so on. But the student now, you want them to perform a basic cardiac examination. Or the student will demonstrate a proper technique for administering intramuscular injection. Definitely, previously, they know what is intramuscular injection, what are important sites for, or safe site for having intramuscular injection, and then they have to demonstrate the proper technique for administering intramuscular injections. The other thing that you have to emphasize in a small group is the interactivity. هي من اسمها, it is a small group, it is a team. That's why the objective should encourage participation, discussion, and collaboration of all students. And remember, medical profession always works in a team. We don't work alone. We work usually in a team. So we have to train our students to be part of a team, to work together, to discuss together, to collaborate, and to participate as a team. For example, students will work together to diagnose a simulated patient. You gave them the signs and symptoms of a case or case scenario, or you bring a simulated patient and they take history from him and so on. And then they will discuss together, they will collect knowledge together, and then they will reach the differential diagnosis or whatever. But this is the things that we have to emphasize in a small group. Sometimes we need to recall, as I said before, we have to recall, maybe, and we don't start in a small group without previous knowledge. No, knowledge is important, and the level of knowledge is one of the important levels in Bloom's taxonomy, and usually it is the starting level. And then we can go through analysis, synthesis, like this will demonstrate understanding of your student to the level before they can compare, they can categorize, they can distinguish, they can design, and then they will took all these things for the application level where they will go into a specific clinical or laboratory or practical session, as my colleague Dr. Nazar will continue. And I remember Dr. Basim gave you the ABCD combination for writing learning objectives, which is include audience, behavior, condition, and degree. It's only to simplify your writing, to make it easy for you to understand what to put in the statements for your objective. The audience, you have to know your audience. Are they students, for example, first year, final year, trainee, they are postgraduate student, whatever, and the behavior provides the action verb. You have to use it from the Bloom's taxonomy, and then you will have the condition. Some of them, they said it is not important. Yeah, not always, it is not a principle, but it is very important for designing what kind of requirements you need to perform your teaching session, and then you will give a criteria for assessing performance. يمكن احنا هواية عدناها، لكن هو هاي this is the way of writing learning objective. Everything in the beginning is difficult, but when you practice writing objective, you will find it easy. Every day it is easier than the day before. We write each objective beginning with a phrase after participating in this session or attending this session or whatever, student should be able to. Then we will choose the verb from that match the desired level of knowledge or skill. اللي احنا نريده level, is it a first level, it is the second from the psychomotor or from the affective or from the cognitive. It depends on what we want the student to perform. And then you have to review your objective to make sure that it will indicate an outcome. And then you have to double check that you have not created a list of learning activity. This is very important. Objective is not listing your learning activity. راح أسوي كذا، راح أسوي كذا، راح أسوي كذا. No. لكن إنه it is not description for the learning activity. Objectives should describe what students should be able to know or do as a result of this experience. فنشوف إنه التركيز, all the concentration is on the knowing or doing of the students, not on the materials itself. I will give you an example of how to break down the learning objective. You will see this example. As a result of completing the respiratory distress session, students will be able to assess respiratory distress in pediatric patients. Okay? If we want to break down this, and you will find what? Assess, we have assess, which is the verb to be used. We have the respiratory distress. We are going to assess the respiratory distress. Where? In a pediatric patient, or in a simulator, or in a lab, or whatever. Okay? Well, assess, this verb, it's the measurable verb. And both of them, the verb and the assess, this is the knowledge and the skill that we want. And the pediatric patients, or this is the context or the place where we are going to perform these activities. There is something to avoid when writing learning objective. طبعا this will you will learn it by practicing, by reading. First of all, as I said, it is not a list, agenda, or list of topic. Learning objective is not a list of topics. It is not an agenda. So you have to avoid, for example, I will give you this example, understand Parkinson's disease. Okay? In this session, you will understand the Parkinson's disease. You will review the pathophysiology of Parkinson's disease. You will learn about the treatment plans for Parkinson's disease. You can see all these verbs that are used here is not measurable. Understand, learn. How can I assess understanding of the students? How can I assess the learning ability of my students? Okay, it is better to write it in this way. Identify the features of pathophysiology of Parkinson's disease. So when I'm going to assess my students, I want them to identify for me the features or the pathophysiological changes in Parkinson's disease. I want them to diagnose Parkinson's disease in a clinical setting. I want them to design a treatment plan and communicate it effectively to their patients. Actually, they are the same, this one and this one, but this one is more vague. This one is more clear, and it will come with the smart things that we have already known. Also, learning objectives are not description of what the teacher or the facilitator will do in the session. It is not a description to your activity as a teacher. So you want to talk about, I'm going to talk about psychological safety and how to create safe space for team members. Okay, this is the doing of the facilitator. I'm going to talk about this. Okay, it is better to put it in this way. Define psychological safety, list strategies to create a psychological safe environment, and develop and implemented policies to create safe spaces for learners in an educational environment, and so. Definitely this and this, they are the same in their context, but this one is very clear, very concise, and it will have a smart characteristic, as we have already said before. I'm not late, Hilal, I'm with time.
لا اوكي بس الصوت دورات يمكن كأنه ما تبتعدين عن المايك وترجعي له، يعني دورات يكون واضح كلش،
يعني
دورات ينزل الساوند. اوكي go on.
راح ألزق بالكمبيوتر. اوكي. Some verbs, as we said, they are not sometimes you will see these verbs in the Bloom's taxonomy, but it is not advisable to use them. Many examples from it: appreciate, believe, know, be familiar with, comprehend, learn, understand. All these verbs is vague. You cannot measure them, although they are all present in the Bloom's taxonomy. But usually we are advised to avoid using these verbs and use measurable verbs instead of them. راح أنطيكم هسه فد two objectives، وأريد تقولوا لي what do you think about them? Which one is better? واحد منهم يقول after participating in this session, attendees should be able to explain change management. الآخر يقول after participating in this session, attendees should be able to describe the 3 essential elements of change management. Can anybody tell me which one is preferable for you?
The second one.
Sorry?
The second one. After
second
participation in this session, attendance.
Why? Why?
I cannot describe it like you.
No, you can't. Just by reading it, you can find the difference.
Yeah. It is the improved copy of the first one.
Yeah, I know it is the improved copy. This one is the poorly identified objective, and this is the well-defined. Because, as you said, explain change management. Okay, what kind of explanation you want? This verb is present in the Bloom's taxonomy. It is part of the Bloom's taxonomy, but it is vague. But when we come to the second one, able to describe the 3 essential elements of change management. I am specifying what I want them to describe. Okay, so definitely, as you said, this one is better than the other one. With time, as you see, with time, by writing objectives for each session you do and repeating it, and it will help if you have a peer review. Sometimes when we write objective for our session, we think everything is clear. But when it is, we ask a peer or a colleague to read them, it will not be that clear with that clarity to him. But this things is very important for improving your writing regarding learning objective. Now we have examples of small group teaching objectives, one of them on maternal. By the end of this session, about maternal health, the students should be able to calculate the important rates and ratios used to evaluate maternal health, interpret on the results of the calculation, work as a team to identify obstacles and delays in case scenarios regarding maternal death or near-miss case, develop plans to prevent the delays in the future. Look to the verbs that are used: calculate, interpret, work, identify as a team, develop plans. All of them, they need to be working together. They need to team interactivity and to reaching and interpreting their results. This is the second one for a family planning session. The student should be able to list the available methods for contraception, which is very precise. Communicate with women to choose the proper method for contraception. وطبعا هذا communication راح يدخل وياها هواية مرات each objective تدخل جواه هواية أشياء. You have to communicate with the woman to choose the proper, because she may have complications, she may have medical diseases not be used, and so on. Demonstrate a proper technique for introducing a hormonal implant contraceptive device under the skin. This is another level. Solve the problems of missed pills. Many things and many levels of skills and knowledge that can be done in a small group session. This is a small group session for the probability and the probability distribution from the research methodology module that we already give in Baghdad College of Medicine. Of course, all these are for year 3 students. Should be able to calculate all kinds of probability. Draw the normal distribution curve. Demonstrate the zones for on standard normal distribution curve to use the Z formula for calculating different probabilities. These are the examples that I'm giving you to know that there is a different level in a small group session for the learning or the doing or even the knowledge. Many of them, you have to put knowledge in them, but concentrate on interactivity, on doing, on skills, because small group teaching is the place for assessing these things. I think if you have any questions about this lecture, or we will keep the questions to the end of the sessions, I don't know.
No, you have to take the question for this presentation and
okay.
the second session, questions after the presentation as well.
Okay.
So please, anyone has any question, please raise your hand.
Any question, please, in this presentation? Yes.
Dr. Sana Jalal.
Yes, thank you, Doctora, for the presentation. The last statement you mentioned we should focus on interactive, like student interactive, like functions. Now, do you mean by that choosing higher levels of taxonomy verbs, like concentrate? How can we concentrate on this activity, on interactive, like in student interactivity in a session? Is it through the verbs or what, please? If you can explain.
Yeah.
Thank you.
Yeah. Thank you, Sana. Actually, in the small group session, as I said before, you may include knowledge level, but the activity in the small group session, it's concentrate on team activity, team interactive. And so you can use the verbs that can measure these interactivity, like interpreting, like discussing together, reaching a differential diagnosis, and so on. That means it's not only by one student, they study a case scenario or يعني a patient, or even in the, it is the same. That a small group teaching session is part of them. They said the clinical session is small group teaching session. But you have to use the verbs that of higher level, not only recall. Recall and the knowledge level is usually used in the large group, sometimes to some extent in the practical, but not always. Even in the practical, you need to have a higher level of instruction.
أنا
Yes,
شوي عندي تعليق هنا دكتورة بتول. دكتورة سنة شكرا على السؤال. هنا we have to think of two things. The first of all, writing objective for a session. And on writing objective for a small group teaching, it's include application. A lot of application and interaction and discussion and team working. These are the criteria of the small group teaching.
Small group.
So there are two things. The objectives to be written using more verbs that link to these three things: communication, discussion, team working, application. And the second thing is that the teaching methodology now is the small group teaching. With the small group teaching, the teaching methodology is interaction, communication, arguing, peer teaching, etc. So there are two things we have to think of it: writing an objective and teaching methodology. We try to make life easier for our audience, is that how to design this objective for this teaching methodology. Therefore, yesterday I talked about a clinical session. Today Batul is talking about small group teaching, and Dr. Nazar will talk about practical skills. So we have to differentiate these two things: writing objectives and teaching methodologies, which is the instructional methodology. Thank you.
yes, we have another question in the chat box.
بتقول بس البرزنتيشن ما صعد على المودل ده يسألون عليه.
Okay.
Dr. Rashna is asking, in pharmacology, it is important to understand the mechanism of action of drugs. So what verbs are suitable to use for this case?
Mechanism, sorry.
The mechanism of action of drugs.
Yeah. يعني mechanism of action of drugs ممكن إنه تخليها as a recall. Sorry, as a knowledge level. يعني أكو أشياء you have to memorize. تمام؟ أو إنه أكو في general principles اللي هي مثلا types of drugs used. كل وحدة أكو عندها الكرايتيريا الأكشن مالتها, and then she will depend on these verbs to use. But mainly it is for the I think the knowledge level, the first level اللي هو cognitive level.
بتقول ممكن أضيف هنا سؤال من دكتورة روشنا. هنا ممكن you may put recall in listing or defining the mechanism of action. You can put compare as a higher level, such as two beta blockers, but there are cardioselective and non-selective drugs. So we can compare these two levels. You can use the verb predict if you given any drug and predict its effect,
yeah.
or predicting the side effect, or predicting complication might happen with it. So you can manipulate it in so many ways.
Now she is asking about the mechanism of action.
Yes, mechanism. I am talking about mechanism of action. يعني mechanism of action of selective beta blocker or going only on the beta 1 rather than on beta 2. So I have to compare between the beta 1 selective and non-selective. So there's comparison. Or predicting the mechanism of action of a drug can be used apart from the recall and listing. There are raised hands, Mariam.
Yes, Dr. Mohammed Nasir.
السلام عليكم.
عليكم السلام.
عفوا دكتورة. In the ABCD of medical education, the textbook, the first edition, it criticizes the whole verb and objectives as using specific verbs tends to be too time consuming the knowledge to a narrow range and not involve higher order thinking or problem solving. It says that, okay, the purpose of the curriculum and being clear about the purpose of the lecture and curriculum is well accepted, but the verb usage or specific verbs is criticized. Is this related to the past edition or in the modern era? Is it was this improved on or I mean, it received criticism. So did that change or?
They criticize what, Doctor? I'm sorry.
بتقول اسمحي
Sorry,
لي
they
I
criticize.
will answer it. دكتور محمد Any, every theory, every new introduction of a learning theory or everything in life, once it is introduced, there are supporter and there are opposer. Some will support the idea and some against the idea. Previously, there was no writing objective and not using the verbs. Once they are introduced to be more specific and measurable, and you can exactly know whether your attendee or the medical or the students is able to do it or not. It was very open and it is very it's هلامية يعني you cannot measure it at all. وهذه one of the point that Dr. Basim yesterday said, what is the disadvantages of writing and objectives. One of the disadvantages for the opposer, they said it limit the creativity because it's fixed a verb to a certain level and it cannot give the environment open for the learner to imagine and doing a lot of things. But in spite of that, it is very well adopted all over the world. Using learning objective is a critical and cornerstone for the learning process. Sure, you will have some articles here and there, some books here and there are against, but the benefit is outweigh the disadvantages.
So the greatest opinion, yes, the overall is right now evidence-based is on defining the verbs.
Yes, yes, using it,
Good.
yes.
And if I can, I want to ask also, we mentioned it, one of the learning objectives as work as a teamwork. Isn't this a little bit vague? Because how can you measure teamwork in a learning objective? How can you assess that?
No, excuse me.
One of the examples.
It wasn't to evaluate the teamwork. Working as a team to do something. You will evaluate the doing, not evaluating the teamwork. Working as a team to evaluate.
Okay. How are we? Isn't working is like doing teamwork? So
when you are evaluating. Sorry, Dr. Muhammad. When you are evaluating a teamwork, you will have it in the evaluation form module, and in the next module for the small group teaching, you are going to evaluate, but not actually you will evaluate the performance of the students to achieve the objective.
Okay, thank you, Doctor. Thank you very much.
Dr. Ahmed Al-Ibrahimi, go ahead.
السلام عليكم، مساكم الله بالخير.
عليكم السلام ورحمة.
أحب إنه أكد على نقطة تكلم بها أستاذ هلال من بداية الكورس، إنه هذا الكورس يونيك لاعتبارات متعددة، منها إنه يشمل 4 جامعات، وهذا بصراحة يعني تقريبا الشغلات النادرة الحصول. الموضوع الآخر إنه include both lecturer or خلينا نقول academic staff and student، وهذا الشيء أيضا يشجع على نقول التواصل والفهم الفيدباك من كلا الطرفين. أحب إنه أنوه إلى نقطة يعني نحاول إنه يعني أساتذتنا الأفاضل إنه يعني الإشارة لها أو الإضاءة لها، إنه نستغل وجود الطلبة ونستثمر وجود الطلبة ويانا، ونحاول إنه نعطيهم فكرة how to they نقول evaluate the objective of the lectures, of the small group, of the process in general. How do they understand the meaning of objective and return back as a feedback to the college about achievement of this objective. يعني احنا بصراحه بالعاده قد يكون من الرؤيه والرسائل والاهداف للكليه نزولا للاهداف اللي موجوده بالوصف الاكاديمي، للاهداف المحاضرات او الليرنينج سيشنز، قد يكون العديد من الطلبه ما يمرون بها او ما يلتفتون لها، مع العلم انه اهميتها الكبرى في انه محاسبه الكليه ومحاسبه الاستاذ اللي يدرس على انه ما انجز المحاسبه، يعني الانجاز بالاهداف وليس الانجاز بتقديم المحاضره. فيا ريت انه يعني يتم التاكيد على هذه النقطه، انه طلبتنا الاعزاء يفهمون او نعلمهم كيفيه التقييم الاهداف، سواء كان على مستوى لكتشر او مستوى على سمول جروب، او يعني خلينا نقول اهداف عامه للكليه. شكرا جزيلا.
Okay, we have a few questions
بس
in the
دقيقة
chat box.
مريم إذا تسمحي لي البوينتس اللي يعني أستاذ أحمد raised it is very important. أستاذ أحمد, previously the education or of medical education was very low in Iraq. There is no such what is aim, objectives, outcome, competencies. Even the terminology were not known exactly by the faculty, by the policymaker. Now the environment, I think, is different, and now it is the time to specify why I am attending this session, why I am attending this medical education capacity building session. Why? What is the objective of that? Everything. It is a lifestyle. Everything. What is my aim? What is my objective? How I come to do it? What is the way to use it? These questions are very important in order you can reach your targets. And starting at medical, at undergraduate level, it is very important, and that is the aim of this course, is to create a group of people knowledgeable in medical education, so they can lead and guide the curriculum committee at the four universities in order to improve the level of education and learning. Thank you.
إذا تسمح لي هلال، you are right دكتور أحمد. حقيقة إنه when we start to enter the يعني الفيلد مال الميديكال education, it was very difficult from the beginning. لأنه أنت إذا تتذكرون، يعني يمكن أنتم كلكم طلاب طبية قبل وتتذكرون حتى بزماننا ما كان أكو أحد يكتب for example learning objective. يدخل اللكتشر بالبداية رأسا كما هو، وإحنا كنا محتاجين على هذا الشيء. When we start بالfield of medical education, we went through many things اللي كانت very strange for us. لكن with time we can improve ourselves. احنا هسه مثلا في كليه طب بغداد من نصعد اللكتشرز مالتنا any module moderator يصعد اللكتشرز مالته على الموديل مالته. منعناهم في الفتره الاخيره انه don't upload lecture without objectives. ففي البدايه طبعا يتذكر استاذ هلال يعني انه كنا معارضه شديده كانت، انه لا تدخلون بمحاضرتي ولا تدخلون، لكن بالتايم بداوا يفهمون انه هي هاي الواي. هذا first step. second step انه to write it in a proper way. فالايديا من هذا الموديولز هسه اللي نسويها احنا we try to make a core people بالميديكال education، لان احنا ما عندنا specialist بالميديكال education، very limited number of persons اللي اخذوا certificate بالميديكال education. اللي احنا نحاول انه لانه هو ماكو واحد هو فقط ميديكال educator، هو لازم يكون عنده another branch، بس هذا الميديكال education هو فد added branch له، فد added activity اللي هي تاخذ ترى وقت وتاخذ تايم من عنده. ومشكورين اكو هوايه من زملائنا، دكتور بسيم، دكتور نزار، يعني على الرغم من كل التزاماتهم مع هذا هم دخلوا بال يعني وركشوبات كثيره ويا كولجز على مود يصيرون medical educator وياخذون في السيرتيفيكيت او في الديجري بالميديكال education. فهو الطريق is not so easy. هو هذا التشينج، يعني التشينج is not easy، لكنه it is never impossible. With time, even us ourselves with time، يعني من اكتب هسه الاوبجكتيف مال هالسنه اكيد better than the objective of the last year and better than the objective of the previous. With time، ويا ما تقرا ويا ما تشوف ويا ما تراجع، يعني practice، هو practice، يعني هو everything is a practice. Even lecturing, acting in a small group is a practice. Feedback from the student is helping you in your practice, and everything will be step by step.
Yes, now
Okay, we have, I think, limited time. Just run quickly for the comment on the chat box, and then we have to take a rest for 10 minutes.
Okay, I will run through it. We have a question. How can we make a place for soft skills like critical thinking in learning objective?
Critical thinking قلناها بالproblem solving, for example. if you remember إنه one of the يمكن examples اللي هي أخذناها إنه problem solving. The problem solving هو one of the ways for improving critical thinking. How to evaluate this, you will take it next, inshallah, in the coming module when you have details how you will perform a small group and the large group sessions and so on. Critical thinking هو ماكو فد شيء to evaluate، لكنه through other things like indirectly through reaching a problem solving, reaching a differential diagnosis of a case, understanding the near miss case. مثلا سيناريو عندك وانت تقعد تسوي لها اناليسيس شنو الديليز اللي صارت او شنو الرونج thing. This is how you evaluate the critical thinking indirectly through other objects.
Okay, we have another question. Does the teaching method for small groups differ from learning objectives presented for small groups in application?
Each small group has its own characteristic. It depends on what you want to achieve. If you want to, you want this small group to achieve improving skills in doing something, definitely the objective will be different. Or you want the students or the trainee to be good in, for example, calculating something, this is different. It depends on the materials that you are going to do, to give.
Dr. Diar is asking about a specific example. He said that at the end of the session, third-year medical students should be able to apply mechanism of action, يعني of a medication in a certain type of cases. His question is, what about this one? I'm not really sure. What does that mean, Dr. Diar?
I think I answered them. And يعني for the apply, يعني it's better to demonstrate the mechanism of action of such a drug. Don't you agree with me, Dr. Diar? I don't know if you understand me. The mechanism of action, and you want to know the mechanism of action, demonstrate the mechanism of action of a drug A or drug B or whatever. Maybe this will be better.
Okay, I think it is time to break. Now we have 1 hour since we started. Mariam?
Yes, now it is 9:30 and we will be back by 9:40, inshallah.
Thank you.
Okay. Is it clear now?
Yes, it's clear. Go
Yes,
ahead,
it is.
please.
Okay. Thank you very much. We start this is the last lecture for this module. So it's writing learning objective for practical skills. I'm Dr. Nazar Haddad, consultant chemical pathologist. I'm not going to repeat the talk of others, but try to emphasize on the top of my brilliant colleagues who mentioned the different aspects of writing learning objective, and they have covered it with a very excellent way. Let's start with the learning objective for this lecture. As we start, we will construct a clear and measurable learning objective. We try to communicate effectively, expect the practical skill outcomes, and apply these objectives to specific tasks of this module. So, if we're going to say what is the learning objective, it's better to mention in one statement as clear, concise statement that describe what the learner expected to achieve at the end of every module. So they provide direct, they provide, sorry. Okay, they provide direction for both teaching and assessment. So this is the important target of our learning objective. There should be an alignment between what is your learning objective, your teaching method or content, and finally your assignment. So let me ask you a question. Why learning objective is matter? I mentioned 4 options. Please try to choose. Go to slido.com and put that hashtag 3343319. So now we don't receive any objections. Please try to choose whatever you want. So you can choose multiple options if you want. Seems that we all options are going to be equal. Okay, we have 23. Okay, so if we answer these questions, so there is someone who wants to share. You can choose multiple options if you think that. So. Okay. Look that the options is going more or less nearer to each other, because why learning objective of matters is actually the 4 options could be the right things, because it ensures structured and focused learning. It aligns teaching activity with the expected outcomes. It guides the development of assessment and instructional materials, and facilitate the learning outcome. So the 4 things could be right for the learning objectives. If we just, you know, the type of learning objective is either with the cognitive domain, with the psychometric domain, or with the affection domains or the attitude. So emphasizing the development of practical skill is crucial in medicine. You should choose where you write and what is the situation you are writing in. And for my lecture today is we are talking about the practical skills such as suturing, insertion IV line, cardiopulmonary resuscitations. These are the skills are essential for patient care. So a good learning objective or the precise learning objective is very important to it. This is just a reminder to you that these are the learning objective of Bloom, and these Bloom taxonomies, that is part of the psychometric aspect. So you see that the hierarchy is going from in different way. So imitations, the learner are observe and repeat the skills. Manipulation, the learner can perform the skills. Precision, the learner performs skill accurately, but without assistance. Articulate, the learner adapt and integrate multiple skills together. And finally, naturalization, the learner can perform a skill automatically by himself. These are the verbs. I'm not going to dig deep into these verbs. So you can find it and we can provide it. These are the verbs for each areas where you can put or use these verbs and writing your learning objective for your practical sessions. And as you know, the start of writing practical learning objective in practice, we will use the same principles, which is the ABC or SMART techniques, but we will try to fit it to our practical work. So, as you know, the ABCD method is the audience, behavior, condition, and degree. So, who is your audience? What should the learner be able to do? Condition, under what circumstances or context will learning occur? And finally, to which degree, to what level or standard he or she must behave or perform. This is very important in creating a statement for learning objectives. So, as you know, our audience, we should identify our learners. The behaviors, we should describe it in a skill verb, which is either perform, demonstrate, measure. So these are the verb, and back to the Bloom psychomotor wheel, so we can find the perfect words that you choose for the practical sessions. Conditions, specify the condition on which the behavior is performed. And finally, define the degree of performance. There should be a definition for the degree of performance. So, let's practice that. Let's see that this is a learning objective. The medical student, let's say it's the third-year medical student, will perform a simple interrupted suture on simulated wound with proper technique, a set of sterile surgical instrument, and this should be done within 10 minutes and achieving 100% accuracy. So if we want to dissect this learning objective based on our ABCD method, it will be like that. So who is the learner in this? The learner, as you see, the medical or the audience of this is the medical student, or you can specify the grade for that. The behavior is the perform a simple interrupted sutures on simulated wound with a proper technique. What is the condition for this behavior? Is there set it within the a set of sterile surgical instrument and within 10 minutes? And finally, to which degree you want their accuracy in doing that? So to 100% accuracy. So in this case, we dissect the learning objectives that we have, and we write it according to the base, or we use the ABC method in writing the learning objective. If we use the SMART techniques, we try to rely on the same methods, or we rely on the SMART technique for writing the learning objective. So from the start, the S of the SMART is to specify and ensure the clarity and focus. So let's see, understanding suturing. Is it a specific learning objective? I will ask you. Please, if you can write in the chat book. So it's too general, nothing specific. So how to perform it specific? Okay. Anybody give us an idea how to make it more specific? Okay, wound suturing. Actually, you should dig more in what suturing you want to do, and which areas, or where is the conditions that you want to do it. So to make it more specific, is it changing? Sorry. Okay, so to make it more specific, perform a simple interrupted sutures proper technique. So this is a more specific aspect of the first one. So our objective should be measurable. Let's see this example. Measure blood pressure. Is it a measurable? Measure blood pressure? Okay, I see the different conflict answers. One said yes and one said no. So if we stick to the statement, the measure blood pressure, this is not quantifiable learning objective. If we want to be more quantifiable, the measure the blood pressure accurately within plus minus 5 millimeter mercury. So here we specify the limits. So how we will examine your student to show how they are perform the measurement of blood pressure, how you will assess them. So to be measurables, you should define a clear statement. Achievable. This is the third part of SMART. You should set a realistic goal. Consider the learner levels. In addition, you should consider the available resources. So you cannot work on if the learner's levels, for example, assign something that is out of their or still they are not prepared for. And in addition, you cannot set a learning objective in a way that there is no available resources to do that. For example, insertion on IV cannula and simulated models within 2 attempts. So this is an achievable one if the simulated arms models is available in your locality or in your skill labs. So I want you to comment on these. Please write these learning objectives because I cannot make it in one slide. The objective 1 said, by the end of the semester, the undergraduate medical student will demonstrate proficiency in performing basic suturing technique on simulated models, including simple, interrupted, and continuous sutures with a minimal guidance. Second learning objective, by the end of the month, the undergraduate medical student will master an advanced cardiac surgical technique, including performing coronary artery bypass graft and heart valve replacement independently. So which of which is more achievable? We have 15 participants, and still all of them said that it is objective number 1. So why nobody choose objective number 2? Okay, what else about the objective number 2? As you see from the objective, so most of the answers mentioned that the objective number 1 is the suitable objective, because objective number 2, if you remember it is short, within the short duration that is not achievable, and you ask unrealistic technique to be mastered by undergraduate medical students. For that reason, we should choose the objective number 1. So relevant, ensure the alignment with the training goals and the clinical practice. So the aspects that you teach your students should be relevant to the training goals, and they're relevant to the practice later on. You should not train them on the course or technique or even laboratory practical skills that is outdated or not present, or even they are not used in their clinical practice. So, for example, demonstrate aseptic technique during minor surgical procedure. This is aligned with the training goals of the medical student. The time bound. It's important to have a time bound for your objective. So it should be not open and within a reasonable timeline for the time bound for your student. For example, complete a sterile surgical hand scrub in under 5 minutes. They should complete their hand scrub in 5 minutes before going to operation. So they should master that skills within the defined time bound. So let's have a practical example. Let's talk about that we want to train our student on IV insertion of cannula or IV line. So the objectives, but let's say that these are second-year medical students, will insert the IV catheter into a simulated arm model following a proper aseptic technique within 2 attempts with no contaminations. So how can we apply a smart technique to this statement? So where is this? Where can we find the S in this? No, I want the specific areas. When we said the S in the smart, we're talking about the specific. Is it specific? Yeah, it is the medical student will insert the IV cannula. So this is the specific aspects of the smart. So what is the next of smart? Is the M. Where can I find the M in this statement? Okay, excellent. So the M, the measurables, is within 2 attempts, no contaminations. So let's forward that to the third part, which is the achievables. The achievables are training that the resources student can realistically perform the task within the given constraints. So this is the realistic aspects. This behaviors will be done by the medical, by the doctors later on, and they should practice on that. So it should be achievables within the training techniques that we have in your lab. Is it relevant? Where is the R? Yes, it's happened in the hospitals, in our hospitals, or let's say it has happened in our practice. Yes, it's relevant to our practice. So it is this IV insertion cannula or the IV catheter. It's one of the skills that is relevant to the medical student, and it's one of the basic skills that is actually mentioned in the Iraqi national outcomes of the graduate. So these skills are relevant to the medical student or whatever you want it. They are in every stage that they have. And lastly, there should be a time bound. So this is during the sessions. There should be you should complete the IV insertions of this objectives. So these are how we can dissect the learning objective basing on a SMART and how we can write it carefully. So these are 2 examples of practical skills that we can write it using SMART and ABC. Another practice, so let's see that from the, if you want to write a learning objective for the use of the glucometer for second-year medical student, and explain how to use the SMART, the ABCD method to create that. So let's see how we can start with this. Okay. It's simply let's put these objectives to help you and understand, and then we will dissect them according to the SMART and the ABC method. So I put 4 main objectives for this session or this training course for medical student. First objectives, they should demonstrate proficiency in using the glucometer to measure the blood glucose in diabetic patients. Perform accurate blood glucose reading within 10% deviations of the laboratory measurement. They demonstrate proper technique in preparing patient for blood glucose measurement, and communicate effectively with the patient regarding the procedures and the results. So this proficiency align with the essential skills required for diabetic patient clinical practice and enhance their competency as future medical professionals. So if we go to dissect this learning objectives, so the audience is the second-year medical student. The behavior is the using of a glucometer accurately. Third, measure the blood glucose in a diabetic patient. That this is the conditions, and for the degree achieving that within 10% deviation from the practical labs. We can use the SMART. This is a specific focus on the use of the glucometer measurement. So this is the specificity of our learning objective. Measurable, define accuracy within the 10% deviation from the laboratory measurement. And achievables, student practice under supervision until proficient. So irrelevant, it is essential for managing of diabetic patient. And finally, time bound by the end of the training session. So in this way, we dissect the learning objective that we write according to the two techniques that we write with. You can identify, and I will leave that for you, how you can identify the verb that we are used based on the Bloom psychometric domains. So take home message, the objective for this practical skills is hand-on applications. Objective should emphasize the performance of a specific skills and the application of knowledge in a practical setting. So students will demonstrate the correct technique for performing PCR function. Active learning objective should involve active participation and engagement. Students will practice and refine suturing technique on simultaneous patient. Immediate feedback, students will receive a real-time feedback on their measurement and should repeat the process for improvement. And finally, every skill mastery test should focus on achieving the proficiency in that particular skill. And that's to say, student, for example, will achieve proficiency in insertion items. And thank you very much for your listening. Please, if you can, rate these lectures or how much you understand from our lecture today. And we are ready for taking any questions.
Yes, anyone who has a question, please raise your hand.
شكرا جزيلا أستاذ نزار. حقيقة أنا استمتعت حقيقة بالpresentation, which is practical examples, a very simplified way, highlighting the importance of putting such a objective for a practical session. I can assure from my past experience that most of our medical colleges doesn't have specific list of skills to be trained on, to have objectives for these skills, and there is no mastery examination for these skills. I am not saying all, but I think most, including when we started at Baghdad College of Medicine. Therefore, this highlights the importance of this session in lightening the way for all of us to start the process of designing objective for a practical session, training on these practical skills, and then mastery assessment of these skills. Thank you very much, Professor Nazar.
شكرا جزيلا أستاذ. ونحن we should emphasize on there is an important document اللي هو the Iraqi national graduate outcomes اللي حضرتك أحد المساهمين الكبيرين في هذا الدوكيومنت. هذا الدوكيومنت يجب أن يقرأ جيدا لأن the practical skills that are essential for Iraqi graduate. I think this is one of the product of the joint committees from the Medical Association, the NCAMCs, and the medical colleges.
And probably may I suggest that the 4 universities that are participating in this course may have application of the same design of a module, like the practical skills. We may create a group from the 4 university working together in designing the what are the list of practical skills to be trained on, and how to put them objectives, and then how to assess them. And I think it will be a very unique example on how to collaborate between 4 universities together in establishing learning sessions and then application. This is a great opportunity for that, I think.
Yes.